So as you guys know, we have a great lead program, and you guys have seen this slide, I'm sure, hundreds of times. We got great leads. We got a great lead for Extra Help. I love the Extra Help program sponsored by the Social Security Administration. People can get up to $5,000 with the benefits per year. I love it. I mean, that's the best lead to work, especially doing lock-in, but it's a great source to also take your business to the next level. Please note this, guys. Listen, okay, whatever you're doing, focus on what I'm going to say right now. Each lead you see right there that you get in your hands, to me, I want to turn that lead not only into a sale, an enrollment, final expense, Medicare Advantage, hospital indemnity. Okay, you gotta do bundling sales, cross-selling. Okay, listen to me now. Okay, but I want to take each one of these leads and turn it into 20, 30, or 100 referrals. See, what I did is I took bits and pieces of all the best of the business, the Tom Hawkins, the Brian Tracy's, the Art Williams. You guys have heard of Art Williams, who built one of the largest insurance companies back in the 70s and 80s. He outdid New York Life and MetLife combined. He sold his company and it was worth $1 billion in 1990. It became the company called Primerica. But you know what he did? He never cold called. He would get to his clients and get to their friends and family and hit their grassroots. And that's how he made his living. And that's the same thing I do here. So if a senior mails in that Extra Help card, yes, I'm going to help her with Extra Help. Please note this, that $5,000 worth of benefits. Okay. That's a huge benefit. It creates a special election. It's amazing how many people don't even know how that works and they get into Medicare. You got to know that lead inside now. Okay. And if they're a dual, they may even qualify for the Medicare savings program. I can help them with that. So that way they don't have to pay that Part B premium. Okay. Everybody clear on that? So then in my next step on the Extra Help program, each lead, I'm become a family member to that lead, that customer. Miss Johnson and I are going to dump each other. I'm going to help her with state and federal subsidy programs. I'm going to help her with Medicare Advantage, MedSup, final expense, what have you. But then I'm going to get into her friends and family and her friends and family, and then I'm going to take off. You understand? That's how you do this. If you want to get to 1,000 sales, you take the leads. Yes, you want to make the sale off that lead, but whether they buy or enroll or not, I'm going to use them to get into their grassroots. I'm going to use that to get to their church group, their VFW they belong to, if they're part of the X Lodge or Masonic Lodge, whatever centers of influence they're affiliated with. I'm going to use the client to help me get in, to open the door up to get me in there. Is everybody clear on that? That's how that type of sales volume is done. And I've done it. And many other agents are doing that. It's not just the lead, it's with the referrals of the lead you get. Same thing with the diabetic piece. Other diabetics know other people that have diabetes, and other people, they say the average senior knows 100 people at their age group, 100 people by first name. I want all of them, or at least 10. See, that my main objective when I went to the house or on the phone, I want to get at least 10 referrals of their friends, their family members, okay? You know, who they go with, who they go to church with, who is their relative, especially the sickest relatives in their family. I want to help them first with how I'm going to do referrals. But then I wanted to make sure out of each lead, I was going to get at least one of their group that they belong to, their grassroots. So if they were a big advocate of going to the Bethel AME Church, a big church in Baltimore, Frank Reed's church, then I want to get that church. You know, I want to ask her if I can come to that church next Sunday and meet the pastor and the board, because I have some great news to share to help them. And I go in it with the premise that I'm going to help them with Extra Help, or the SPAP program, which we're going to talk about shortly. New Jersey has a great one. Maryland has a great one. I'm going to help them with the no-cost federal and state subsidy programs that are available. Veterans, the same thing. When I help their veterans in the church. You see what I mean, guys? That's what I did. So if I'm sitting with that client or on the phone with that client, yes, I'm going to make the sale, but there's two sales being made. I want to make the sale on the product that I'm helping them with, but I'm going to also make the sale of getting into their church, their food bank, wherever they volunteer, whatever they are associated with outside of, their work relationships. And sometimes if they're still working, let me correct myself on that. If they're still working, I'm going to the job, because I'm sure there's seniors there and other people there that need my help. Does everybody understand that? Is that clear? Hello?
Yes.
That's how
Yes.
that's how you do this business. The average referral closes at 70 to 90%. The average lead closes 20 to 30%. So which one would you rather have more of? More referrals. How do you get referrals? It's from the lead cards of the client you're seeing. You have to build that bond and trust with them, then get into their friends and family and grassroots clubs. Okay. And we got plenty of other type of leads. So leads are not a problem. We got over 60,000 of them. So to me, it's really more than 60,000. If you take 60,000 and times that by 10, look out, look how much opportunity we have there. There are untapped resources. And that goes back to what Tom Hopkins shared in terms of effective prospecting. Okay. So that's what we're going to talk about today in terms of effective prospecting, utilizing the UNA Health Card. Because we got Facebook leads, we got voice verified leads, we got internet leads. Leads are not a problem, but we're not working the leads effectively as we should. So again, I want to repeat, you're there to help them with a specific product. But number two, the other opportunity to help sell is getting into their grassroots. Next slide, please. So these are some of the grassroots programs that we've talked about. As you guys know, me personally, mine was church groups, because it really helped me with my spirituality. I was raised Catholic, but, my mom also took us to Baptist churches because she was kind of done the same way by her family. Her mom was a Catholic. Her dad was a Baptist. So, growing up, we went to two churches, Catholic church in the morning, the Baptist church in the afternoon. So, I tapped into that because of just, it worked for me, and now and then I did VFWs and I did other clubs and lodges, but primarily my grassroots was churches. But I have agents like Debbie Brown out in Phoenix, Arizona. She just worked YMCAs. It worked for her with the Silver and Fit program, and she was there every week at different senior workshops and, swim club. And, they had, aerobicize and all these different things and yoga for seniors. She was there and picking up referrals. So you got town halls, you got malls, you got diners. Find what works for you. You got dentist office, doctor's offices. You also have dialysis centers. As you guys know, of last year, end-stage renal disease, is no longer, not allowed to get into the plan. They removed that from the application, so they can now have end-stage renal disease, be on dialysis, and get into the plan. So that's another opportunity. And for me, what really exploded for me on the church groups, which I love so much, y'all know the story about Pastor James Gray, and that really, was the biggest hit for me in my career back in the early days. And he turned, it was the most amazing thing. I'm gonna give you the short version. The man sent in 2 cards and told me no twice over the phone. I called back in because I was mad because I spent like $25 for each one of those leads. I got $50 invested in this guy, and he said no and laid into me on the phone, and and it was just a comical experience in the beginning. I couldn't believe he was like yelling at me and cursing at me, and it was like he had Pastor James Gray, so he was a pastor too. I'm like, man, I ain't never met a pastor talk like that. But you know what? I don't know where he's coming from. He's probably irate and frustrated about things going on. Who knows? And probably gets calls from insurance agents all the time. So get this. I went over there anyway. I talked to his wife, Mary. She let me come over to meet with him. And he was kicking me off the porch. He's like, what are you doing here? I said, well, your wife let me come here. And he goes, well, no, you getting out of here. He's calling the police to get me arrested for trespassing. But what got him excited is I told him about the UNA drug card benefits and the tithe program. And it turned into the biggest hit that I ever had. I went out there. You guys know I watched it, the services, and they got down. They had a bass player and a drummer, and and they had the Martin Luther King fans. I was fan of it. It was so daggone hot. It was like a sauna, but they were getting down in that church, man. And then at the end of it, they took me to the rectory, and I thought, say I grew up Catholic. We got like a sip of wine, and you got a wafer. They had like a full Thanksgiving spread in the rectory, and it just took off. And it was like 80 seniors there, that I presented to and showed them how to work, and picked up 80 sales that Sunday. And I tell that story because that was my first big grassroots group. And it was North Point Baptist over in Dundalk, Maryland. And then what ended up happening, not only I got everybody, more people in that church, like 300-400 sales out of that church. He ended up turning to me because I didn't know he was a bishop. He was part of this organization with the bishops, the Baptist bishops in the Mid-Atlantic. He ended up setting me up with so many other churches. I didn't have to go. I didn't have to touch my lead cards for the rest of the year. I was busy working all the churches. So guys, that's how I got started in grassroots, and I never looked back. And every year, that's what I did as an agent. I did that effectively for 8 years, and it was nothing for me to do 30 and 40 and 50 sales in a week, and I'm going to tell you, it wasn't all Medicare Advantage, guys, because sometimes these people don't need Medicare Advantage. They may already have a plan that they're happy with. I sell them final expense. I sell them hospital indemnity. So those are multiple sales, but either way, get this, if the average sale was say $400 in commission, let's say if the average, because I'm counting final expense, Medicare, Med Sub, hospital indemnity, let's say if the average was $400, take 400 times 1,000 enrollments. What do you got? That's $400,000 in commissions. And that's where the elite are in this business. And the elite that I know of in the business, it's based on their acts. First of all, selling themselves. They got to be great. You got to be good at selling you, not a product, not a service. You got to be good at selling yourself. Then it comes down to activity. Whoever talks to the most people, okay, that had the highest probability of closing, like the type of lead, hint, referrals, is going to make the most money. Let me tell you this. If I'm going to make 5,000 presentations per year, let's say that's your number. I'm going to make 5,000. Wouldn't it be easier to do off of referrals than leads? Think about it. If one's closing 20% and the other's closing 70%, which do you want more of? More what? More what? Referrals, right?
Referrals, yeah.
How do you get referrals on steroids? You go through grassroots. You can get 50, 80, 100 referrals in a room, or on a webinar. You can even do this through Zoom, and it make your life so much easier. Okay, so that's what I'm just trying to drive home to you guys. So let's go to the next slide real quick, because I know we're running out of time and I want to have time for some Q&A. So the UNA drug card, I brought this to the company about 6-7 years ago. And originally, go back, Michael, stay on that slide, go back. I'm not ready to go over that yet. So originally, when I got started in the business with American Income Life was a labor union insurance company based out of Waco, Texas. I started there in 1994. And I was an 8-time Chairman's Club member. Many of you guys that work with him know that's pretty incredible accomplishment. I made every convention, did extremely well, went from agent. And matter of fact, I was on an agent contract. We had a 40% contract back then. And I made 6 figures on a 40% contract. In that first year, I didn't know there were other deals out there. I didn't know you could get 100%. I was on a 40% contract. I think John told me when he first started, I think it was, John, you started with Prudential, right? John? Lost you there, John. Anyway, John started, I think, with Prudential on like a 50% contract. So I had no clue that there were 80, 90, 100, 120% contract, but I killed it on a 40% contract. And how I did that, it was through referrals. After my first month working leads, I was busting my tail. And a guy named John Hayward says, you're missing out on the real opportunity. You got to be promoting what they had back then was called the co-health program for the union, where they can get $1,000 AD&D. They can get a free discount vision, prescription, and hearing program. And that's how I got started using discount health cards to generate hundreds and thousands of sales. And I took off. It made my life so much easier when I was going through referrals, from referrals to referrals. So we created, CoHealth went out of business many years ago. So I picked up the UNA drug card, which is phenomenal. It's been around for a long time. Over 1.3 billion in savings nationwide. It's a pretty incredible program. And what I love about it, it doesn't cost anything. Go to the next slide, Michael. So the UNA drug card came about. So I need to have something to go into my grassroots and get additional referrals during my sale and at the end of my sale. So the power of the UNA drug card, it helps you get appointments. Okay. So when I'm on the phone making appointments, I'm not just making an appointment to deliver the extra help program or talk about the extra help or Medicare changes or the vets. I always included the UNA drug card, or back then it was called the co-health plan. So it helped me get appointments. When seniors and people in general, knowing they're getting something for nothing that could be of value to them, and make sure you got to understand, you got to sell the UNA drug card. Okay. You got to be able to sell it even though it's free, I still had to put the secret sauce on that. If that makes sense. So it helped me get appointments. So you guys have seen our scripts. If you haven't go into the boot camp information, the script is there. So when I'm on the phone with somebody and they're giving me debate and they're giving me objections, I say, you know what, Ms. Johnson, I appreciate you sharing that with me today. But listen, you can never have too many benefits. I know you don't know me from Adam, but if you just give me 1% of your trust, I'll earn the other 99%. This is real clear. I want to be real serious with Ms. Johnson before you hang up. But this program here I'm about to show you, the Extra Help program's worth over $5,000. That's about $400 a month back to you and your family. But in addition to that, I have a program that can save you another $4,000 to $5,000 in healthcare benefits, and it's absolutely no charge. Okay, you can get your glasses done. You can get prescriptions at 75% off. You can get glasses for $25. You get hearing aids at 50% off. Miss Johnson, you can also get dental coverage, diabetic supplies, and the program is absolutely free. Miss Johnson, just listen, all I ask you is give me 5-10 minutes of your time. That's all I ask. You don't have to buy nothing. Let me just help you with this program because I'm in this to help people and change lives. I'll walk out the door. We'll be friends. Let me help you with the extra help. Let me help you with the healthcare card. I'm going to give you at no charge, and I'll be on my way. You wouldn't believe how many people let me in, let me have the appointment, talk to them, get referrals, and they buy it anyway. Because you know what? Everyone's first response in sales is, I'm not interested. But this card helped me get into so many doors and helped me get so many appointments. It's unreal. So more about the health, the drug part of it. The UNA drug card is a highly innovative pharmacy benefit manager. Okay. It's a PBM. Okay. That provides consumers proprietary prescription drug benefit program solutions. These programs are delivered through retail pharmacies like Walgreens and Safeway and Walmart, employer groups, unions, associations, and other PBMs. The UNA drug card pioneered the development of unfunded prescription drug programs. The UNA drug card pharmacy network is in all 50 states, okay? The Virgin Islands, Puerto Rico, and Guam. The UNA has more than 240,000 participating providers, serving more than 114.9 million members. Guys, just in 2012, the year that we launched this, the first year, $1.31 billion in savings. Is that pretty incredible? Hello?
Yes. Hey,
Yes.
Can I ask you a couple questions on it?
Yes, go ahead.
So you know how when you're on an MAPD plan, they say, well, you can't use another drug card. I'm assuming this would not negatively impact or make it look like they have another drug plan, correct?
You're absolutely correct. Discount drug cards do not affect their Medicare plan. Okay, and I'm going to go.
Is there any time that it could lower whatever Cigna gave them on their drugs? Could it lower it? Or
let me go to the next section because you're stealing my thunder. I'm going to go right into that. I'm just going to explain it to you. Okay?
And I was going to ask the same question about the dental. Can they use it with the dental as well? Thank you.
Yeah, let me go through the next part. I'll get right to that. Okay, so go to the next slide, Michael. Okay, this is going to be cool. Okay, by the way, it has been seen on TV, Fox News, ABC, CNN. You can see all the news networks that's been featured on. This is a copy what the card looks like, okay? And it's used for all the services. There's a pharmacy hotline you see there, 1-800-223-2146. There's also a customer service line. So what I would recommend you guys do, if you have questions or concerns, you can go tap into the phone number, give them a call. If you're new to this, you know what you should do first? Enroll yourself into it. Which is what I did. Before I started presenting this to the team, I enrolled it, started using it myself, and it actually worked for me when I had hand surgery a couple years ago, and I forgot my pain medication on a trip to Chicago. My prescription was almost $90. I got my prescription for $17. Okay, so it really works. So make sure you guys call the hotline number. They get an ID number. You guys can see the ID number. The BIN number is 610709. And then there's the group number, okay? So all that's there for you guys. You guys can order cards. We've got plenty of cards you can order, okay? And it's right through our website. Michael at the end will show you guys how to do that. But it's an incredible program. And what you can do, they have even a zip search. You can look up your client zip code even before you call them. Let's say you already talked to the clients, you're going to follow up call back. You can actually go in, put the zip code in, and it'll show up all the pharmacies, all the dentists, all the vision providers within 5 to 10 miles of their house. It's a pretty incredible program. And most of our agents don't even know it exists. So it's pretty amazing. And yes, you can customize this program to suit your client. So what I do on the front, if you can flip back, Michael, go back to the front, the first page. If you look at the bottom there where it says sponsored by Global Premier Benefits, we actually can replace that and put the name of what I do. What I did is that I kept Global Premier Benefits there, and above that, I would put in sponsored by Bethel AME Church, or VFW Lodge 103, or Food Bank Plus, whatever. And it was be a dual sponsorship, so it's being given at no charge by Global, but also the church. So that way, the church or the VFW, the Elks Lodge, or the doctor's office were like, wow, you're going to put my name on there? What's that going to cost us? Nothing. All I need is a copy of your logo, and I'll stick it on there for you guys. Sometimes I just did a label in the early days, and now with the technology we have now, you can customize this brochure to suit your client's needs, okay? And you wouldn't believe how many churches wrote that. Their name's on it. It's pretty cool. Got it? Move forward, Michael. So it helps you get appointments. It helps you, by the way, close sales, guys, by patching it in your sales presentation, and it really does work. And I'm going to go to helping Carrie with the next question. Go ahead, next slide, please. Okay, so the prescription drug benefits. This is clear because you don't want to mess with people's prescriptions. Please make sure you let your client know it's a discount health program. This is not an insurance plan. It's a discount health plan. See, a lot of people don't realize a lot of these pharmacies and retail providers, they mark up the drugs, they mark up the hearing aids, they mark up the dental products, they mark up. So some of them 200, 300, 400, 500%. So, those drugs cost $5. Okay. They charge sometimes $50, and the $45 is their markup. All we're doing is taking out the markup. So this program makes prescriptions more affordable for the uninsured. So you can use this with people that are not 65 yet. So they can be 20-year-olds, 30-year-olds, 50-year-olds, 80-year-olds, 90-year-olds. There's no restrictions. There's no claim forms. There's no paperwork. It's for the uninsured and the underinsured, and can be used to supplement most health insurance plans. It's designed as a standalone benefit program, but it may also be used as a supplement for insured prescription plans to cover non-formulary prescriptions. So let's say somebody's got a plan, Medicare plan, or, a different healthcare plan. And let's say 4 out of the 5 drugs are covered. That 5th drug may be out of the formula. They got to pay completely out of pocket. It will help with that non-formulary prescription. It can also be used as a Medicare, Part D supplement, by covering drugs once participants, get this, reach their donut hole, okay? Make sure you note that. Membership to the UNA drug card program is completely free, okay? It's not like those plans you see on TV they're paying $10 a month for. They don't tell them that on the commercial. This one's absolutely free, and it actually saves them more money than that plan you see on TV, okay? And it's available to everyone. So they don't have to be, they could be 5-year-olds, so they can be 105. There's no personal information, need to be collected. It's not required to join. And there are no enrollment forms, no eligibility requirements, and there are no restrictions of any kind. They can create a card online if you want. We have the hard copies. It is a quick and easy process. Through this program, you receive savings up to 75% or more at over 56,000 national and regional pharmacies. The program uses lowest price logic, LPL, to guarantee that members always get the best pricing on brand and generic prescriptions. So when you go into the website, the way it works, you put in their zip code, and they can do this themselves. It'll show like 5 to 10 pharmacies within 5 miles of the house. And it'll actually show the prescription. You can actually put the name of the prescription in, the milligrams are taken, and it'll pop up every single drug, you know, and where it's located and where they get the best savings. It's a really amazing program, okay? So they can use it with whatever plan they can, but it's not there to replace their Part D, guys. I want to make sure we're clear on that, okay? It is a discount card. And as it spells out there, it helps with drugs in the formulary and outside the formulary. Next slide, Michael. Okay. So additional benefits, they can get glasses from $25, prescription eyeglasses. They can save 30% on dental plans that's in the network. Okay. And they can save up to 50% on diabetic supplies. Okay. And also 40 to 50% on LASIK surgery. Okay. A lot of healthcare plans don't cover LASIK surgery. This program can help them save up to 50% on that, and also 50% on hearing aids. Now, some of the benefits will help your clients. Some of it won't. Okay, if they already got it solid in their current plan, fine, leave that alone, but focus on the things that can help them with. Okay, go to the next slide for me, Michael. So additional benefits, I want to make sure we're clear. Okay, these are the websites if you want to check them out. Okay, your client will be enrolled in these, but if you want to learn more about the dental plans, you can go right into the website there. You guys can see that Choice Plus Dental. Okay. Shows them how they can save on dental plans. And if the person already has a dental plan, you probably want to leave that alone unless, you know, they're paying too much for it. But most Medicare Advantage plans, it's already included. So the dental may not be a good option for them, okay? There's also the glasses program you can see there. You can look that up. It's $39glasses.com. You can look that up there. That's the website. You know, diabetic savings plans, you can see that there. Go into the website. Okay, the vision plans for LASIK surgery, you can go there. They'll have all the providers they need, and also the hearing plan is through ushearingplan.net. You know, many clients and agents have told me stories about the seniors having to get a hearing aid. It costs them $2,000 just for one hearing aid, and they can save $1,000 on the hearing aid. So that's a pretty amazing feature. To the right there, you can see it also has additional benefits. It helps them with mortgage payment assistance. If people are struggling with their mortgage, you can help them with that. And it doesn't have to be a senior. It could be anybody. That it's a free consultation where they can get help if needed. And it's a great program to help those that are struggling. It also has free bankruptcy advice section to it, which is awesome. Debt relief hotline. You know, it's another feature of the program, and tax relief hotline. So these are just additional free services they can utilize to help them with every situation they're in. Okay. So like I said, it might not be the health side of it. It could be the financial side they need help with. There's a lot of people out there that are still struggling, you know, financially. We can help them out. And again, I want to reiterate, this is not just for seniors, it's for their children and grandchildren as well. One card, if they live in that household, represents everybody in the household. So I want to drive that home next slide, is that you got seniors out there in the world we're in taking care of children and grandchildren. Okay. It's just the way it is, especially in the low to middle income market. So this program can be used to help them as well. So you're going to have seniors taking care of grandkids. If the senior's grandkid gets sick, who's paying for that prescription? Okay. Grandmama is. Okay, if the grandbaby needs glasses and the daughter's a mess, say in drug rehab, who's paying for the grandkids' glasses? Grandmama. So grandma can use the card to do benefits for the children and grandchildren. You wouldn't believe how many sales I've made just with that feature alone, that their grandkids can now use this card at no extra charge. So we have what's called the Global Premier Benefits Friends and Family Network. They can receive the free card to anybody in their family, friends, family, children, grandchildren, churches, and any other nonprofit organization. Okay, and it's absolutely no charge. And for more information, you can see the information there. You know, we have our own toll-free number there. You can talk to me about it, or you can go right to the companies themselves and see how it can help them and their families.